What is malaria? Malaria is a sickness that mosquitoes carry and pass on to people. It's caused by tiny parasites called Plasmodium. People have been fighting against malaria for a very long time. The earliest signs of this parasite were found in mosquitoes trapped in amber about 30 million years ago. Malaria was such a big problem during the time of the Roman Empire that it's sometimes called Roman fever. It's even believed to have weakened the Roman Empire. The credit for finding the parasite goes to Charles Louis Alphonse Lavien, a doctor from France. He got the Nobel Prize in 1907 for his discovery. What causes of malaria? Malaria can happen for different reasons, like getting bitten by a special mosquito called Anopheles stevens, using needles that someone else with malaria used, having an organ transplant, receiving blood from someone with malaria, a mother passing malaria to her baby during childbirth. What are the symptoms of malaria? Symptoms of malaria usually show up about a week to 2 weeks after getting infected. Common signs include fever, feeling tired, shivering, throwing up, and headaches, upset stomach, feeling weak, and muscle pain, sweating a lot and having seizures, pooping blood. In bad cases, malaria can cause seizures, going into a coma, and even death. Sir Ronald Ross studied how malaria spreads and helped scientists learn how to fight it better. He found out that a certain kind of mosquito, the female Anopheles stevens, carries the disease. By dealing with these mosquitoes, we can stop malaria and save many lives. How is malaria treated? The kind of treatment you get for malaria depends on how you're feeling, how old you are, and how healthy you are. If you catch it early, treatment works better. Waiting too long to get treated can cause big issues. The treatment you get will be different depending on which type of Plasmodium parasite you have. Treatment may include antibiotics. These medicines kill the parasite in the blood. Supportive care. You may need medicines such as acetaminophen for fever and IV intravenous fluids if there are complications. Prevention of malaria. Malaria is a big reason why people die unnecessarily around the world today. It affects more than 500 million people every year and causes 1 to 2 million deaths annually. It's mostly found in tropical areas, with about 90% of cases happening in sub-Saharan Africa. There are 2 main ways to deal with malaria: stopping mosquitoes from biting in the first place, or fighting the parasites once they've already infected the body. The first way involves using things like mosquito nets and bug sprays with permethrin to keep mosquitoes away. The second way uses a chemical called quinine from the bark of a cinchona tree. A drug called chloroquine has also been very good at treating malaria, even though it's not a vaccine. How is malaria diagnosed? Your doctor will ask about your health history and where you've traveled. They'll also give you a checkup. You might need blood tests to make sure it's malaria and not something else. Your doctor can use a microscope and other tests to see if there are malaria parasites in your blood. What are possible complications of malaria? Malaria can get worse with a type called falciparum malaria. It's the most dangerous kind. People with a bad case of this type might have liver and kidney problems, a spleen that breaks open, shaking in fits, being in shock, falling into a coma, bad effects on a baby if a pregnant person gets infected, even death. Who is at risk for malaria? The risk of getting malaria depends on where you're going, how many days you'll be there, where you'll be staying at night. Anopheles mosquitoes usually bite more at night, from sunset to sunrise. Malaria in pregnancy. Pregnant women are at higher risk of getting very sick from malaria compared to those who aren't pregnant. Nearly half of pregnant women with severe malaria die from it. Malaria during pregnancy can lead to miscarriages, babies dying before birth, premature birth, low birth weight, and newborns dying. The risk is highest during the second trimester, so it's important for pregnant women to get proper care to prevent and treat malaria. One of the main reasons pregnant women get malaria is because of a parasite called Plasmodium falciparum. It can pass through the placenta and cause serious problems for both the mother and the baby. Pregnant women may not have enough antibodies to fight off this specific type of malaria parasite, making them more vulnerable to getting sick. Complications of malaria in pregnancy. Malaria can cause serious problems during pregnancy, including babies being born too small, called low birth weight, because they didn't grow enough in the womb, or being born too early. This can lead to more babies dying. Other problems from malaria during pregnancy include moms getting very tired and weak because they don't have enough healthy red blood cells called anemia. Losing a baby before it's born called a miscarriage, babies being born dead called stillbirths, babies getting malaria right when they're born called congenital malaria. Pregnant women are especially at risk of getting really sick from malaria, which can cause their heart not working right because they don't have enough red blood cells called congestive heart failure, the baby dying before or during birth, moms dying from bleeding too much while giving birth.